Welcome back to the Contact Lens Institute YouTube channel. I'm Dr. Stephanie Wu from the Contact Lens Institute, and today we're going to be talking about one of my favorite subjects, keratoconus. A lot of patients have asked us, what are some good contact lens options for keratoconus patients? Keratoconus patients are probably my favorite type of patient to see in the clinic. And in fact, I've dedicated my entire career to helping these patients see better. And over 70% of the patients in our practice have keratoconus. So it's something that I am a true expert on. I absolutely love helping keratoconus patients see better. So I'm really excited to talk about this topic with you. So one of the first things that I think patients should be aware of is soft contact lenses. This is something that patients are constantly asking about because they find out that their friends or family members wear soft contact lenses and they want to know if they can wear them as well. In short term, it really just depends. If you catch keratoconus really early and cross-linking is performed to stabilize the cornea, there is a very large chance that you will be able to wear regular soft contact lenses. However, as the disease progresses, or if you catch it a bit later, the cornea, the shape of the eye is already irregular, so a soft lens will just not cut it. You can always ask your doctor if they think you'd be a good candidate, because that's always, the first and typical approach if your keratoconus is mild enough. The next thing is custom soft lenses. These are still soft contact lenses, but they are purely designed for keratoconus patients. Usually you have to be fit in the office by an eye doctor. It's not something they can just order and then just try on. Most of the time you have to do an actual fitting with a doctor that specializes in keratoconus. But again, if you are in that kind of mild to moderate category, custom soft lenses that are made for keratoconus could be an option. Another lens is something called a hybrid lens. This is where the center of the lens is made out of a hard contact lens, and then it's surrounded by a soft contact lens skirt, essentially giving you the vision of a hard contact lens and the comfort of a soft lens. So there's a couple different lens options as far as hybrid lenses go that are developed specifically for keratoconus patients, and this is also an incredible option. The next option is something called a corneal gas permeable lens. Now, when keratoconus patients were first fit into lenses, they were fit into something called hard contact lenses, which are a little bit different than corneal gas permeable lenses. The hard contact lenses that maybe friends or family or patients that wore back in the 60s, 70s, 80s, those were actually made of a material called PMMA. And the problem with that is that's the same plastic as a screwdriver. So there is no oxygen that gets to the eye, which causes a lot of long-term ill effects that we don't want patients to have. So now there's something better called gas permeable lenses. They really look the same, so as a patient, you would really not be able to tell by just looking at the lens because the feel of the lens and the look and the shape, really everything is the same to the naked eye, but the material that the lens is made out of is breathable, so it gets oxygen to the eye. So those are the types of lenses that most patients are wearing nowadays that are fit into gas permeable or hard lenses. There's so many gold standard type studies and lots of clinical research that shows that corneal gas permeable lenses are safe and effective for managing keratoconus patients. Some of the benefits are that they're a little bit cost effective compared to some of the other modalities. So a hybrid lens, a custom soft lens, and a scleral lens, sometimes those can be a bit more expensive. And so if you're looking for a better option financially, that could be a better option. Another thing is they're very durable and they last for a long time. Soft lenses will need to be replaced every 3 months, every 6 months, every year, depending on what type of lens the doctor fits you with. But a gas permeable lens can really range from 1 to 3 years as far as the lifetime. And my final and favorite option is something called a scleral contact lens. And that is what majority of our patients end up wearing if they're good candidates. So the beauty of a scleral contact lens is that the weight of the lens is resting on the white part of the eye. All of the other options I've discussed, the weight of the lens is resting on the cornea, which is the clear membrane that's at the very, very center front part of the eye. And on that membrane, that little tissue, there's tons and tons of nerves. So anything that's touching it can produce a sensation, or it can be uncomfortable. A lot of patients complain that their eyes are very watery because the lens itself is uncomfortable. So with scleral lens, the beauty of it does not touch the front part of the eye, the cornea, at all. All of the weight of the lens is on this white part of the eye, which has much less sensation, and the edges of the lens are tucked underneath the lids and lashes, which creates a very stable and centered environment for the lens. So again, scleral lenses are an incredible option for keratoconus patients, and probably 90% of our patients that have keratoconus are fit into those types of lenses if they are a good candidate. I hope that's helpful. If you have keratoconus, or if you know somebody that does, we would be happy to take a look and consult with you to see what type of contact lenses that you would be a good candidate for. So make sure that you click the button below and sign up for an appointment anytime, and we'd love to connect with you. See you next time.